let's start again.
You did?
All right,
Okay.
here we are. We are starting Dan's pod change. We have all of the supplies here for you. Most of these, if they're not here, will be above the microwave or on the microwave.
Or in a baggie, like I said.
Or in a baggie, like Jen wants to do. We have skin tack wipes, Curad alcohol swabs, Unisolve, and this is what they look like individually or in doubles. Insulin, a pod, Dan and Cleo.
Hi.
So these will either be, again, in a baggie, pre-prepared for you, or if not there, in a
On the microwave.
in their boxes on the microwave.
Can I show this?
We also need Dan's PDM.
We don't really need Cleo either. I mean, she helps, but
So this is his PDM.
not necessary.
He can do this part. Dan can do this part. Do you want to walk through this?
Sure.
What I'm doing here?
Alright, I'll take them.
Wait, just tell him. Just
Okay, so
narrate.
you will hold down the home button until you get the screen. Press the button below confirm. Usually that'll happen. Press the button under OK.
Wait, I'm trying to show them what it says. Okay.
Yeah, there we go. Press the button under OK. Now press the button under home. And go down two, or just one. I mean, sorry. Down one.
It's hard to see, but it says more actions.
Yeah,
What's that?
where it says more actions. Press the
Select.
button under select, and then press
Change
the button
pod.
under select again. Okay. So what you're gonna want to do, here, I'll lay down for this. So you're gonna want to press
Confirm.
confirm, and that'll deactivate the pod that's on me. Won't help if I actually push it. You'll hear 2 beeps. That means it's all done.
Next, we take the Unisolve. This is what makes the Stickum not stick.
On the old pod.
You just go around the edges on the white part.
You don't have to apply a lot of pressure.
Just make sure it's saturated.
And then Dan will remove the pod.
And that can just go in the trash.
Yeah. Make sure it is deactivated before you take it off. Because you don't want that beeping.
It says remove and discard the pod and then press next.
Which we did.
No active pod. Would you like to activate a pod now? Yes, I would. So this says fill a new pod with insulin. After filling pod, listen for 2 beeps, then press next. Do not remove the needle cap at this time.
Okay. So at this point, you take the alcohol swab, open it, wipe the top of the insulin vial, open up the new pod package. The pod package has both the pod and the syringe to fill the pod with insulin. Screw the needle onto the tip of the syringe. Remove the cap. Go down to 150 units, about, give or take some. Put air regarding that amount of volume into the vial.
So you're pushing it in.
So yeah, because you're removing a volume of insulin, so you have to insert that equivalent volume of air.
Because math and physics.
Right. So you go about how much you put in. Doesn't have to be exact.
Give or take a few, yeah.
So we usually go to about 150.
Flick it a couple times to get any bubbles out.
This doesn't have to be
bubbles are
perfect.
Yeah, it doesn't have to be perfect.
'Cause
The
it'll
pod
prime
will
it.
take care of it.
But you're going to want to try
You
it
don't
as
do that
much
yet?
as you can.
Right, now I need to...
Now, there's a little arrow pointing to a circle. That's where you insert the syringe and then just plunge it in.
That's what she said.
If it beeps before you're done, just continue to plunge in.
But it beeped after I was done.
Which is good.
Now you
Once
look
it's
at
done
this.
beeping,
Press next.
and then make sure that it's near the pod. It'll click.
PDM is near the pod.
It says priming, and it'll click.
Do you hear it?
While that's going on, you prepare the site of the new pod. In this case, it's going in his back on the left.
For your case, it'll be going on the butt.
No, in your case, it'll be going on the butt right there.
What is it? Right here.
No, other side, Dan. Because
No.
we'll do this one on Tuesday. This one will be what they do.
Right.
So I'm just putting alcohol
So yeah,
over
you
it
wipe
just
it
to-
with alcohol first, just to make it clean, and then you wait a few moments until that dries.
Or you could just leave it.
Or you just let that dry. The next step is to prepare the site where you just wipe with alcohol with the skin tack, which is the sticky stuff. You open that. This will make your fingers sticky too.
You can use alcohol or Unisolve to wipe that off after.
And you apply that to where you're going to put the pod. Again, in your case, it'll be down here.
Tickle.
Sorry.
Those got to be ready.
And you let that sit maybe 30 seconds or a minute.
And meanwhile, you can wipe your fingers with the alcohol
Yeah,
swab.
if your fingers are sticky, you can use either the Unisolve or the alcohol to clean them. While this is going on, the pod has been priming, and it now says,
Prepare infusion site. Remove pod's needle cap. If cannula sticks out, as shown below, press discard. We've never had that happen.
we never had that. That means this little plastic part, you pull that off. Unless you can see a little blue straw,
Kind of like on the
which
old
you
one.
can see on the old one. If
You're
you
good.
don't see that there, which we
You're good.
never have,
You're good.
you're good. You say next.
Then it says, remove pod's adhesive backing. If pod is wet or dirty or adhesive is folded, press discard. If pod is okay, apply to site.
So you pull off the adhesive. There's two pieces. And this one is going on Dan's back, the left side of his back, and it's facing out.
So you kind of look, it doesn't have to be perfect, but it should be where you skin tacked and use the
And
alcohol
where
swab.
similar to where the other one was. Ask him to stay still.
And then just,
Push around. You can push the middle of it to make sure that everything is stuck well.
Make sure you
Push the-
press around the edges too.
mm-hmm.
Make sure everything is.
And it's stuck there. And then you go back to the PDM. You say next because everything's
And then,
stuck well.
and then stop.
And stop.
And then
And
you
it says-
hand it to Dan.
It says press start to insert cannula and begin basal delivery. That's Dan's press.
Yeah,
You
don't
hold
do
his,
that.
you hold his hand, and he presses start. And then the PDM has to be near the pod.
You hear it
You
click?
hold his hand, it's clicking.
Fine.
It makes a loud click, and that's when it goes in. You check it.
You see
Make
the
sure
pink?
you see pink. Hold still.
Oh, sorry. Other side.
Make sure you
Nope.
see pink on the pod, and you can see in the little window. If you see
There's a tiny little blue
a
straw.
tiny little blue straw,
You
That's
can
in
see it
my
goes
skin.
in there.
you can see it goes into his skin. And it says, okay. Go to the PDM, and you say, yes.
It's just, is cannula properly inserted? Yes. He's all set.
And you're all set.
That's it.
And that's it.
And then you just throw everything out.
And Dan's happy.
Don't be worried if the other pod side is itchy or anything.
You can also
Yeah.
wipe that other old pod site with the
Unisolve.
Unisolve
or
or the alcohol to make it.
Come off. See how
Come
that
off.
comes off? And if it's itchy, he can put some Benadryl on it. Cream.
Benadryl cream.
That is all. Thank you for watching, and
Call us if you have
call us if
problems,
you have any problems or
and
questions.
Dan will walk you through it.
Oh yeah.
Love
Don't
you.
worry. Bye bye.